very easy to, you know, you can't turn on any of the channels right now without seeing, you know, 12 different people in all boxes giving all of their opinions. And really, just like Dr. Harani has this slide up here, really just the CDC is really the best, the World Health Organization. There's so many people out there 24/7 right now giving their opinions. Go straight to the actual credible places for your information. The CDC is updating their website like several times a day. They have a brand new section, which I put in the email that I sent out to you guys about ways to really keep your mental health up. Because, you know, when feel like we're locked in a box, we definitely have, you know, it stops it stops our mental health. So we also need to be very conscientious of, like Dr. Harani said, getting outside, taking a walk. Not only are you going to get some natural vitamin D, but it's important for mental health, because we can't just be locked in our little offices at home and not expect that that's going to also take quite a toll. And then also we have gotten some email questions. And what I heard Dr. Harani say to all of us, and we have it on recording, is that we can eat dessert now. I mean, did you all hear that?
Maybe. Yes,
Sorry.
please be kind to yourselves, but like I said, be strict at the same time. Find your balance.
I know. I'm just here for community. If you are having symptoms, we do want to let you know, contact your primary care physician. We do not have test kits here at Rose Wellness. So call your primary care physician office first. Don't just go into them, because definitely everybody's doing basically what we're doing also, which is virtual visits and telemedicine. So if you have some questions, if you hover down in the kind of the center bottom of your screen, there is a chat box, like a little message bubble. You can click on that and it'll open up and you can ask your questions there. One of the questions that one of the patients emailed in was, and you kind of went over this, for the vitamins, the extra vitamins to beef up our immune system. Do you prefer that we try to get those through food? Or if we don't feel like we are getting it through food, can we do it on the supplement?
Yes, absolutely. I mean, I definitely encourage the food. I think that's very important. But if in doubt, and, you know, sometimes it's hard to get, you know, the actual 6 servings of vegetables per day, you know, that you need to get all of those nutrients in. So it doesn't hurt, especially right now, to take multivitamins, a good quality one, especially if you're older.
Okay. And then I know we've gotten this a lot, and I know that you and I had talked about it. Some of the patients are sending us portal messages saying, you know, my specific vitamin C or whatever is out on Vita Living. So do you want to let the patients know what you had told me that you recommended for them?
Yeah, so it's going to be a little bit tricky right now to find, you know, some of the immune supplements out there, things like C, D, you know, some of the herbs, etc. Please don't panic. Right now, it's okay to get any, you know, Vita Living has mostly good quality, so you want to check over there first. Find any brand that's similar to what you're already taking. But if you can't find it on Vita Living either, that's okay. Reach out to other websites and look for something similar that I have recommended. Whatever you can get right now is better than nothing. So definitely keep on hand. I would say the elderberry syrup, melatonin, and those ACE inhibitors that we had talked about, the natural ACE inhibitors, as well as the vitamin C. I think, you know, if you were to develop symptoms, I think these are things that it's not going to hurt to try to reduce the severity of the disease.
And you had also recommended, just as with everything that you take, always make sure that you turn the bottle around and look at all of the everything that's in there that makes up that supplement, in case you have an allergy or something that you're reactive to. So
absolutely, very important. And if you want to run by something, you know, just send me a portal message. I'll take a look at it as well.
Okay. And then another email question was, isn't this less lethal than the flu?
No. In fact, I have a slide. Oh goodness, what did I do with that? I had a really good slide. I was going to leave it on here, and then I I got rid of it. No, it's not. It's much more lethal than the flu.
Okay.
Go ahead and ask more questions. I'm going to look for that slide in the meantime.
Okay. Another one, hold on, I'm trying to bring this up on my phone since I can't do it on my computer while we're on this, says, I don't see anything mentioned in the CDC website about cleaning objects you bring into the house, especially groceries. In theory, someone could have sneezed on my can of tomatoes, bag of frozen peas, etc. Do I need to wipe down cans, boxes, bags? Is washing produce with water enough?
Very, very good question. In fact, I just got just today, one of the medical organizations that I'm part of sent some information about this. And yes, some of this can last on surfaces, not on foods. Interestingly, this virus doesn't tend to last on food so much. Of course, it's always a good idea to wash your produce anyway. Really make sure you wash it out very well. You know, you can even dilute a little bit of vinegar in water and wash, you know, your fruits and veggies in that. But generally speaking, we're finding that this virus is not sitting on foods. Now, as far as the grocery bags and things like that, yes, it is on some of these surfaces. And some of the, especially metal surfaces, it can be on there for days as well. So if you do have gloves, you know, it's a good idea when you're bringing your grocery in to kind of use the gloves and, you know, just take out your fruits and veggies, throw the trash bags away, and then take off your gloves and make sure you wash, you know, you sterilize kind of that whole area with your chemicals. That's a very good question. Yes.
Okay. And then another one wrote in and said that they're hearing that the patients that have passed away from COVID-19 were found to have had ibuprofen in their systems.
Yes, that also, so there was a very small study done in France with 20 people. What they found was that those, even the younger people, those that had taken ibuprofen had much worse disease. However, since then, the World Health Organization has kind of looked at this a little bit more, and they're saying that's not really valid. That probably was coincidence in those particular people. So, you know, there's still, I don't know, I think there's still a little bit of controversy out there, although the WHO is saying you don't have to worry about that. If you feel like you feel safer with, you know, Tylenol or acetaminophen, that's fine. I don't think it's a huge deal to take the Advil or Motrin. Keep in mind, even Tylenol can affect your liver. So if you're taking too much of it, and because, you know, some of these multiple organs can be affected by this, Tylenol can potentially present a risk as well. So I don't know that there's a right a wrong answer here. But as far as what the World Health Organization said, they've discounted that. They've said that the COVID-19, you can take ibuprofen.
All right. And then we had one here. It says, for cleaning, does regular household cleaner instead of bleach, disinfectants, etc., work for cleaning high-touch surfaces? It's currently hard to find those disinfectants. I know I could probably sell this right now for a lot of money online.
Yeah, your household cleaners like Lysol, you know, there's something called Dettol too, and, you know, some of these other ones. Yes, it can be effective. Like I said, the good news is with the coronavirus is it's got that lipid layer, which is easily dissolved through some of these regular household cleaners. Yes, it doesn't have to be bleach.
And a lot of people, what I found interesting is, you know, you'll go to the store and all of the bottles of the Lysol wipes are out. You know, all these are cleared out of the shelves, but then there's bottles of all the sprays right next to it that are all fully stocked. And so those are actually more effective. It's been found to spray it and wipe it with a paper towel than you know, than to do it with the preloaded wipes. So
Yeah, exactly. And please, you know, wear a scarf or something around your face so you don't keep breathing in those chemicals. You want it there for the virus, not for you.
right. All right, then we've got another question that says, I think you said that melatonin can help reduce symptoms of COVID-19. Do you recommend we take melatonin each night as a habit?
Very good question, and no, I don't. So the studies found in melatonin was, again, more related to reducing the respiratory effect, you know, the negative respiratory effect of the virus. So if you start to develop symptoms, then maybe take it. Now, you know, for people with autoimmune conditions, however, you have to be careful with melatonin. it's not absolutely contraindicated, but sometimes melatonin can worsen autoimmune conditions. So we don't know enough just yet, in that scenario, what melatonin is going to do. But, I would say in those people, if you really do get severe, I don't think it's going to hurt to just take melatonin. At that point, whatever you can do to try to help yourself. But I wouldn't take it unless you're at that severe state. And for people that don't have autoimmune, if you start to feel symptoms, yeah, go ahead and then take melatonin, but no, not necessary to take it every night as a routine.
Okay. We got another question. Will this video be on our website? So the short answer is no. We definitely, this Q&A session, we are only hosting for you guys, our members. So this is definitely not going to be on the website. We may, depending upon how things go, send out the first part of the recording with Dr. Harani's immunity tips and everything. But I will be emailing all of you both of the recordings of her presentation, and then also this Q&A session. So those will be coming out to you in an email shortly, probably over the weekend. Then we've got another.
Before you move on, Amy, let me address that question somebody had about the flu.
Yes.
I found that slide, which I thought was very interesting. Can you see my screen?
Yep.
Give me a moment. Okay. So this was an interesting slide I found in a pretty good, this is actually, the source of this is the CDC, WHO, and the National Disease Control, as you can see down there at the bottom. So the number of how many people will be infected by an average individual with the disease for the flu is about 1.3. Remember we talked before about the COVID-19 spreading it to about 3 people, give or take. The flu spreads it about to 1.3 other people. The time from exposure to the first symptoms in the flu is 1 to 4 days. In the COVID-19 is 1 to 14 days. So you could be walking around for 14 days, having it without symptoms, spreading it to people.
Yeah, that could be why that number
having
is
it
so
for a couple
big.
days. Okay?
Yeah.
The hospitalization rate for the flu is 2%, 19% so far with COVID-19. So that is significant. And the case fatality rate, the percentage of reported deaths among total cases, is 0.1% for the flu and 1 to 3.4%, depending on where you are in the world, for COVID-19. So this is not, the flu is already a huge deal. And then this on top of it is much, much, much worse.
Okay.
And the reason why is because none of us have an immune system against it. That is the reason why. Whereas the flu, a lot of people already have existing memory cells or immune activity against older flu viruses that they've been exposed to in the past.
Right. Then we had another question. Are all office visits done by Zoom for the time being? Yes. So the last week and this week, we have been doing all virtual visits, and Dr. Harani has made the decision just to err on the best side of caution and to keep everybody safe. For the next 2 weeks, we are going to be, so that's next week and the week after, we're going to still be doing all virtual and phone consultations for your guys' consultations.
We'll probably keep reevaluating every 2 weeks at a time. I mean, right now the Virginia Medical Board, not just the medical board, but the federal government has said that they want to prioritize virtual visits. So
Yeah.
I'll just wait to hear what their recommendations are and continue forward with that.
Which hopefully with them coming out federally, publicly saying we are encouraging telemedicine, hopefully more and more insurance companies will now get on the bandwagon and start paying for the virtual medicine.
It certainly seems that way. Yeah.
Yeah. So one of us will be here in the office Monday to Thursday from 8:30 in the morning to 12:30 p.m. just for you if you need to come by and pick up supplements. We're also getting the messages off the phone and returning portal messages and all of that. So we are here for you. You can schedule appointments directly through your patient portal if you think of it and it's not a time when we're here in the office. You can schedule them directly through your patient portal. You can click on request appointment and it'll show all of Dr. Harani's availabilities. You can also schedule your health coach appointments. This is a perfect time for you to schedule your health coach appointments also. We can set them up all virtually or on the phone. So that's for the next 2 weeks what we've decided to do. We're just going by the guidelines that we've been given to keep everybody safe. Let's see here. Another question is, I use mostly natural cleaning products like 7th generation, which cannot be found. The active ingredient is thyme. Is it okay to make my own with thyme, oil, and alcohol?
I mean, I love thyme oil. I think that's great. And you can certainly make your own. I don't know that I can answer your question based on research because I haven't seen much about thyme and how effective it is against coronavirus. So I just don't know. But you can certainly make your own. Vinegar is just a general good disinfectant too, by the way. But again, I don't know its effectiveness against coronavirus per se, so it's hard for me to answer that question.
I know there's a lot of natural solutions that people are coming up with. I saw on Pinterest, there were a ton. So been
Yeah,
trying new
cool. So
recipes on Pinterest.
if we've got that link, maybe we can send that out. That would be nice to know.
Mhm. Any other questions, anybody? All right. If a person develops symptoms, should we develop a wait and see attitude or try to find a test kit from a GP or emergency room?
Very, very good question. So what we're finding with the COVID-19 is from the time you develop symptoms, if it's going to get severe, remember 80% of people are mild and they get over it. But if you're going to develop symptoms, a common symptom we're finding is cough and shortness of breath with fever, these three things. So if you have those classical symptoms, and if it's very mild, the first thing you want to do is isolate yourself, even in your own home. Self-quarantine, even in your own home, preferably if you do have your own room, if you do have your own bathroom, so that you can at least protect the others in your house. Whether, you don't know at that point whether you have COVID-19 or not, but you want to just isolate. Generally speaking, if the disease gets severe, it's getting severe within the first week. People will quickly notice a lot of difficulty breathing, shortness of breath within the first week itself. So you want to monitor yourself for sure. If at any point you feel like you are not, obviously if there's anything acute or urgent, go to the emergency room right away. But if it's relatively mild and bearable symptoms and you're feeling the shortness of breath, I think it is a good idea to contact your primary care. That's what the guidelines we've been given from the medical board right now is contact your primary care and see how they guide you. Some of your primary cares have testing in their office and they have protocols for testing you. Hopefully a lot of them do now. But if not, they can direct you where to go. The last thing that they want you to do right now is go to the emergency room if you're just having mild symptoms, because you don't want to potentially infect other compromised people in there. So step one, isolate. Step two, if you're having those three classical symptoms, then contact your primary care for further guidance. If you're not having those classical symptoms and you're not sure, it's kind of like I'm having a runny nose, a cold, I'm feeling, just a little mild cough. I mean, it could be allergies, it could be just the common coronavirus or cold, and if you feel relatively mild, you can just self-isolate at this point. But fever, shortness of breath, cough, I would definitely contact your primary care physician.
And also, I know that I've seen on the news that there's these drive-through testing locations.
Yes.
Those, do you know for a fact, Dr. Harani, do they have to have an order from their primary care,
Yes.
correct? Okay.
Yes.
Yeah. So definitely contact your primary care to get.
Yeah, there's definitely one in Arlington. I know they're making more in other areas. I think Fairfax is, if it hasn't already, is coming up with one already also. So you can get just an order from your primary care, go through the drive-through and get tested over there as well.
I think they're doing some in DC also somewhere.
Yeah, absolutely. I mean, if in doubt, get tested. But those really are the three classical symptoms. If it's mild, I would still, again, take the right precautions, but you don't necessarily need to go and test. And again, whenever in doubt, call your primary care.
Right.
Good.
All right. Any other questions, anybody? Just type them in the chat box. We want to make sure we get all your questions answered. Also, I just wanted to just talk to you guys super briefly about your memberships. I know sometimes questions come up and you want to, you're like, okay, I really just need like a 15-minute consultation, but I think I may be done with my visits. A lot of patients that are maintenance maybe have already used 2 of your sessions, but maybe the sessions didn't take as long as you got allotted for them. So it really is it's I know when we initially put the information out, like I'll just talk about maintenance members for right now. It was you get a one longer appointment for that annual blood work, to go over all of that for the full functional medicine assessment. And then you get a follow-up appointment that's 60 minutes. So what we're really giving you though is we're giving you that 75 minutes plus 60 minutes. So you have like a bucket of time. So think of your, so if you only took a half an hour at your annual visit, then you've still got that 15 minutes. If you have any questions or want to know how much time you have, you can just write me a portal message and I'll check. So you've got kind of a bucket of minutes that you can use. And we don't want anybody to think, even if you're out of your, we can always, we're here to help you. We're here to help you when you're struggling, whether it be with Dr. Harani or with Elizabeth, our health coach. She is wonderful. If you're struggling with a detox that Dr. Harani put you on, schedule an appointment with Elizabeth. She's great, and she can really help you through those detox questions and help you get some relief. And the same thing with your health coach appointments. Whatever you have allotted, it is a time-based thing. So, maybe you're not going to do a full 45 minutes. Maybe you only talk to her for a half an hour one time. Then you've still got 15 minutes left over. So,
and at some point we are working on technology so that you can actually access that information. So in the future, you'll be able to know how much of my minutes have I used up, how much do I have left. You'll have it at your fingertips in your portal somewhere. You won't have to depend on us, but we're working on that. It'll come out hopefully sometime soon.
All right. Well, I don't think we have any other questions. Thank you, everybody, for logging in. We're going to email this out to all of our members. If you have any questions in the meantime, obviously send them through the patient portal. And thank you so much. Everybody get out. The sun is still shining for now. It's supposed to rain again, but it's still out there. So everybody go get your mental health walk and walk around, get some vitamin D.
Yeah, and as if any of you have watched Dr. Sanjay Gupta, as he keeps saying, we're all in this together, and never before have we all been so dependent on each other for each other. And that really, really is what it is. We're all in this together. We're going to get through it together, help each other out. These are the times to really focus on positive thoughts. Keep yourself, just keep yourself positive. Promote positivity, not only to yourself, but to those around you. Just kick those negative thoughts out. Okay.
Yep.
Everybody stay safe, stay healthy. Thank you so much.
Thank you.
Bye, guys.